Well, welcome back, everyone, to the Brain Soul Show, where neuroscience meets that deeper intuition of your soul. And I'm real excited to have Dr. Amie Hornaman with me today. She is the author of the Thyroid Fix, and it is an awesome book. I did listen to your book, Dr. Amie, and you're doing such great work out there. I know that you have an advanced thyroid and hormone clinic. You're an international telehealth practice. You're serving patients really across the United States and Canada, and you're a host of your own podcast, right?
Hmm.
And yeah, and you're just doing such great work out there. I am so excited to have you on because so many of my women, have thyroid issues even if they don't know it,
Yeah.
right? Even if they don't know it. So what was the reason you decided, hey, I've got to write this book now? I've been doing all this amazing work with people.
Yes. Oh my goodness. Well, I think this book has been in my brain now for years, if not decades, in serving and helping my patients for that long. But I knew I needed to get something on paper and get it out there into the world for two groups of people. Number one, we have, just like you mentioned, we have the subset of mainly women. We'll say women because it does affect women more than men, but
Mhm.
guys, you do get hit with this as well. To serve that subset of people that are walking around with all of these symptoms and they are being told over and over and over again by OBGYNs, PCPs, endocrinologists, naturopaths, functional doctors that they're normal. Nope, your labs are
Mhm.
normal. You're normal.
Mhm.
Everything is fine. You're just getting older. Why don't you just eat less and exercise more? And they have been so, I'm just going to use the term medically gaslit. They have been
Mhm.
so medically gaslit through the years
Mhm.
that they themselves now truly do believe it's like they've shunted their own sense of their body and they've put their own intuition on the back burner for what other white coats are saying to them. You're normal, you're normal. I must be normal. It must be, no, nothing's wrong with me. I was told that my thyroid was normal 5 different times. So there can't be anything wrong with it. And there really is. So I want that group of people to know and understand that I see them and there's an answer and there's hope. And you always, always, always listen to your body because you know your body better than anyone. And then there's the
Mhm.
other group of people that you're
Mhm.
diagnosed. You could tell us right now you have a thyroid problem, you have hypothyroidism, you have Hashimoto's, you're probably on Synthroid or levothyroxine, or maybe you're on Armour thyroid or NP thyroid, and you're not feeling your best, but you truly believe that this is as good as it's going to get because your doctor is telling you that your labs are normal too, and there's nothing more we can do. And that is not the case. There is true optimization possible for everyone. And what it takes is us digging a little bit. And it's very, very simple, despite
Mhm.
what your doctor might make you feel. It's very, very simple to unpack and uncover thyroid dysfunction. And it's very, very simple to treat it as well.
Oh, that's really good. Okay, so what are some symptoms that people might experience that is going to give them a clue that they need to get some help, like from someone like you? What would be some of the symptoms that you typically see?
I love this question.
Mhm.
So, we're going to start off by the phrase that I always say, the thyroid, from head to toe, it runs the show. So, we're going to start at the top. We're starting at your hair. So, hair
Mhm.
loss, hair breaking, dry, thin, brittle. Then let's go
Mhm.
to the brain, your favorite area of the body, with
Mhm.
you might experience anxiety, depression, memory loss. I've had patients come in thinking that they have early Alzheimer's, lack of motivation, lack of drive, just that flat affect. You can't remember, you can't think, you're not creative, you're not processing anymore. Then we can go down to eyesight, loss of the outer corners of your eyebrows, obviously your metabolism, your ability to burn fat. So either you're gaining weight, you're not losing after doing all the things, you just have that weight loss resistance. We
Mhm.
can have low heart rate, low body temperature where you're cold when everyone else is normal. We can have blood pressure irregularities. You could have been diagnosed with AFib or tachycardia, some type of heart issue when it's really your thyroid. Then we can go down to digestion, bloating, constipation, dry skin, brittle nails, knee pain, migraines, joint pain. It literally affects every single system of the body.
Wow. Wow. I mean, yeah, that's a lot.
Yeah.
If it's affecting all of those things. Absolutely. Okay, so then the next obvious question is then how do you fix it? You know, if it's not labs and you're right, you go to the doctor and they're all going to tell you you're fine, it's in your head, all that stuff that we hear. Uh, how do we work with that? How do we unpack that and really work with somebody based on the symptoms that they come in with if their labs are normal?
So it really is, we'll break this down into three steps, three-step process. So
Mhm.
number one is the testing, but it's going beyond TSH because
Okay.
TSH is, it stands for thyroid stimulating hormone.
Hmm.
And this is really the number one test that your doctor will order when you go in and you say, "Hey doc, I have a thyroid problem," or "I heard this woman on a podcast, I want to get my thyroid checked." You
Okay.
can't say that because all you'll get is TSH. So what we have to do is we have to test thoroughly. We have to look at every single marker, and I'm going to give those to you right now.
Okay.
So, yes, we can check TSH.
Hmm.
Sure, why not? But then let's go further and let's look at free T4. Now, T4 is a hormone that your thyroid gland actually makes, where TSH is actually produced in the brain. It's a brain hormone. We want to look
Okay.
at, yeah, it's released by your pituitary. Well, you know the brain, right? Hypothalamus talks to the pituitary. The pituitary releases that thyroid stimulating hormone to go down to the thyroid and go, "Hey, thyroid gland, you're not working real well. Come on, wake up." And it starts kind of
Mhm.
screaming at the thyroid, poking it to wake up a little bit. Now we have to look at the thyroid itself and look at the hormones that it produces. So T4 is an inactive thyroid hormone. We have what, 37 trillion cells in our body, and not a single one of them has a receptor site on it for T4. We want to look at it because T4 has to go through a transformation process, a conversion process, and it has to become the active thyroid hormone T3. Now we look at free T3. I want to know how much unbound, beautiful, active thyroid hormone you have coursing through your veins that are it's
Mhm.
ready to attach to those 37 trillion cells. I want to know how much do you have and do you have enough?
Ah,
Then we
good question.
right? We want to
Hmm.
know that, obviously. I mean, even
Yes.
when I say that out loud,
Hmm.
listeners should be like, "Well, yeah, that seems important to me." That seems
Right. But
that
no one
makes
ever taught me
sense.
that, right? But nobody ever taught me that, right? Because what most people know is TSH, right? Thyroid stimulating hormone, because
Right.
that's what doctors test for. But more like functional medicine doctors or yourself, people like yourself might test for the T3 and T4 if you're feeling that with that client or that patient, right? You really need to look at that for them.
And I'm a firm believer, you do a full thyroid panel on everyone with a pulse. You
Oh,
check
okay.
that.
Okay.
Every single,
Uh-huh.
and especially if they are over the age of 35, you check them twice a year with a full thyroid panel. Because
Hmm.
there is such thing as thyropause, which happens to women after the age of 40, where your thyroid takes a beating when you start going into perimenopause. So you better be checking your thyroid at least twice a year with this full panel. Now,
Okay.
Louise, you had mentioned functional medicine and naturopathic medicine. So this
Hmm.
next marker is going
Hmm.
to shed a lot of light on your listeners because many of them might be seeing a functional medicine practitioner or a
Hmm.
naturopathic doctor. Here's the one way to know whether or not the person you're working with truly knows what they're doing with the thyroid. Do they test reverse T3 every single time?
Yes, yes. Tell us
Yes.
about that. Explain that to our audience here.
So reverse T3, it's a powerful, powerful test. And do not ever let your doctor say it's not needed. Don't let them tell you it's only tested in a clinical setting. After you hear this
Mhm.
explanation, you will never dismiss this test again. Reverse T3 is built into our body as a survival hormone. What do I mean by that? If you're in a car accident, if you're in a traumatic, you have a traumatic injury and you're lying in the hospital, you're lying in the ICU or the ER, you're literally fighting for your life. You know, our bodies are so smart. It knows that when you're in that state, you don't need to burn fat. You don't need to make major decisions or balance your checkbook. You don't need to think, feel good, or even poop every day. You need to lie there and survive. So, what the body does is it sends a signal out to shut down all other processes. We don't need to have energy today. We don't need the brain to function today. We don't need this person to have a metabolism today. Let's shuttle the energy to healing. But what if there's nothing to heal? What if you're not
Oh,
in the hospital? What if you're walking around trying to run a business and be the best person that you want to be to yourself, your family, your employees?
Mhm.
And reverse T3 is telling your body that you're dying. That's a problem. And that's something that we want to know. Now, what reverse T3 actually shows us is how well your body is taking that inactive thyroid hormone T4 and converting it to the active thyroid hormone T3. And then that plays a huge, huge critical role in the next step of how do we treat. So, first we test. Oh, I'm sorry.
Mhm.
Step number two now is looking at those markers, looking at your results through an optimal lens. What do I mean by that? So that means that we're not going to look over at that standard lab value range that's next to your result and call it normal like your doctor is. We're not going to say just because you fall within that huge standard range that there's nothing
Mhm.
to see here, everything is fine. No. What we do is we come in with like a little microscope and we go, I want this free T3. I want it in the upper quadrant of that big standard lab value range. Yeah, that lab value range goes from a 2.3 to a 4.4. I want you like 3.8 to like 4.5. That's the
Right.
sweet spot. That's where you're going
Nice.
to feel your best. That's where you're going to
Mhm.
lose the weight. That's where your brain's going to be on fire. So we test
Mhm.
thoroughly. Then we look at those results through an optimal lens, not just normal. Normal is a setting on the dryer. We don't use it to describe your labs. We want you optimal. And then
Okay.
we treat. And then we treat.
Mhm.
Now, I want to really talk about this treatment paradigm because as you know, Louise, so many people have this block in their mind about medication, especially in our world. We
Yes.
want to do everything naturally or with supplements.
Mhm.
And I get that, right? Because
Yes.
there are medications that are overprescribed. From statins to
Mhm.
blood pressure medications to antidepressants, they're overprescribed. And they're almost to the point of being band-aids. Band-aids of symptoms where there is really an underlying root cause, i.e., maybe thyroid dysfunction. When
Mhm.
we talk about thyroid hormone replacement and when it's done the right way, so when it's personalized to you in the combination for you and in the dose for you, you
Mhm.
will feel amazing. And what we're doing is
Mhm.
we are replacing hormones that are no longer being properly made by your body. So essentially, thyroid medication is hormone replacement, just like we now have bioidentical hormone replacement for the
Mhm.
hormones that are declining in midlife. And as we move
Mhm.
into perimenopause, menopause, thyroid's no different. We are taking these beautiful natural hormones that your body just isn't doing a great job at making anymore for one
Yep.
reason or another. And we're
Yes.
we're bringing them in to bring your level to that beautiful state, the state that you were in when you were, 12 and you had abundant hormones and everything was functioning well and you were healthy.
Yes. Yes.
That's what we want to do. So
You know
we
what
have to shift.
I have to I have to share this. So I'm in my 60s and I am one of those people that does everything natural. Okay. And I was taking, adrenal supplements. I'd still do that, right? Because I always believe the kidney, adrenal, thyroid are related. So
Yep.
we'll ask you about that next year too. But my doctor just put me on a very low dose of NP thyroid and
Hmm.
thyroid factors.
Hmm.
And I didn't think I needed it. Okay. Like I was supplementing myself with all these other supplements. Oh my God.
Yeah.
And
How'd you
so
feel? How do you
I
feel?
I feel great. I feel better than I have in years, and I just went through another little sort of health crisis thing, and I am like so good. It's like my DNA is optimized. I mean, I feel like I'm in my 40s. Generally, I have good energy throughout the day, but I work kind of hard. I do kind of push myself. I have to balance. I'm getting better at balancing. But I
Hmm.
didn't think that was going to make a difference, and it did. And I just want all women to know, just like Dr. Amy sharing here, it's a hormone replacement. If you need it, open your mind, allow some things to happen that are going to give you optimal health. And then also look at all those other factors, your age and everything. And then I clear the field. So I clear the energetic field and the trauma patterns that can be in the brain that are also causing hormones to be off. So you
Hmm.
might need some of that too. But this is incredibly valuable right now. So thank you, Dr. Amy.
Well, I love how the work
Yes.
goes together. Like your work and
Yes.
my work go together so beautifully because just like you said, Louise, we can't bring in hormones onto a brain dumpster fire. or a
Right.
trauma-filled dumpster fire, right?
Hmm. Hmm.
Because those patterns that you work with and that trauma and that stress is literally going to kind of tying in to your previous question about the adrenals and the kidneys. It's going
Yes.
to, we're going to bring in these beautiful hormones. They're just not going to get to their receptor sites properly because you got almost like gunk in the way. And
Yes.
you clear the gunk
Hmm.
so I can bring in the hormones and they can do their job.
Right,
Mhm.
exactly, exactly. So it's a whole, it's a putting the pieces, and many people are putting the pieces of the puzzle together for that,
Yeah.
and you work with this too. I work with people who want to be optimal, almost like the athletes. I've worked with athletes too, who want to be like optimal, optimal brain, optimal health, almost like the giant biohackers of the world, right?
Yeah.
Really, and they treat their business that way too, right? They want to make a bigger impact in the world. And then also
Right.
have people who just want to feel better too.
Yeah.
They don't feel good, so they can't do the business the way they want to, or their relationships the way they want to. And we got to look at what are the causes of all of that. And I think what you're pointing to here is that sometimes it's thyroid, and it might not be looked at that if those labs are normal,
Yeah. Yeah.
right?
Exactly. That's
Yes.
exactly it.
Yes, absolutely. So speak to I always saw these organs when I was in my office, Albuquerque Natural Health Center. I saw these organs always pop up on biofeedback. I do a lot of neurobiofeedback with people. And
Mhm.
I would always see if it was a thyroid thing and the woman was just put on thyroid medication, let's say, that it was also adrenal and kidney. And then the underlying cause of some of that I saw was Epstein-Barr virus, protozoa, parasites,
Mhm.
candida, and kind of a combination of all those toxin things too that also needed to be detoxed. And as a naturopath, of course, that's what I help them do. So
Yeah.
how much of that has to be addressed when you're looking at just, the thyroid issues?
Yeah. So everything plays in the same sandbox, as I say.
Okay.
So we can look at a big sandbox and we see thyroid in there, we see the hormones in there, we see insulin, we see cortisol, we see your liver, we see your kidneys. And then
Hmm.
we see those other things that you're talking about. Epstein-Barr virus.
Hmm.
I haven't met a person yet who doesn't have it. I got a frame ready to go. It's a blank frame ready for their picture. I'm waiting for one person who doesn't have EBV. We pretty much all have it. I mean, I tested on everyone. We pretty much all have it. Um, Parasites, I mean, I think we all have those too. My goodness, I have a dog that kisses my face. I've walked out, I've eaten sushi and walked barefoot. Like, okay, I got parasites. It's
Hmm.
it's how the question is how I like to use the term shored up. That's from my youth, like shored up, like how
Hmm.
strong, how shored up is your body?
Hmm.
If you are living in a more optimized state, your hormones are balanced, your thyroid's balanced, you've done great work with your food, your sleep, your lifestyle habits, your movement, your stress, your grounding, all of that.
Hmm.
When it's shored up, you can be exposed to the mold, you can be exposed to the parasite, and
Hmm.
you could even have an Epstein-Barr virus flare, and it doesn't take you out. It's like
See.
I give this story. I tell this story a lot. When we were searching for a home, you go in different homes, see them. We went into this one, and immediately when I walked through the door, it's like I smelled that musty mold smell.
Hmm.
And I didn't turn around and leave. We did the whole tour of the house, and then sure enough, you go to the basement, and on the back wall, I saw it black mold. And we were in there for about 45 minutes to an hour. So I left and I was stuffy and I retained water for like a day or two. And then my body took care of that exposure. I mean, you and I both have clients, patients that if they
Hmm.
did that, they would be out for the next 2 to 3 months
Right,
with some
right.
kind of severe mold contamination, disease, whatever
Hmm.
reaction.
Hmm.
So it's like these things will come at us, stress will come at us, our cortisol will go up and down. Life happens. We'll be exposed to toxins, pesticide, mold, all the things. But how built up are you? How healthy and strong is your body? And that really does start from internally
Hmm.
looking at that hormone, thyroid balance, insulin, cortisol optimization that allows your body to defend you when you are faced with those exposures.
Yes, absolutely. It's the immune system, right? I
Yeah,
always think about the immune system as a rain barrel. Somebody gave me this analogy years ago, and so here's your immune system. It's a rain barrel, and you have this stress, and then you have that mold exposure, and then you eat bad food, and then you've got this going on, and then pretty soon you're overflowing, right? It's just too much. So it's in my mind, what I do is I keep the total load down.
yeah, yeah,
I'm making sure I keep the total load down. I'm not going to eat bad food when I'm traveling. Traveling
right.
is stressful anyway. I'm going to eat healthy, right? So you're going to make those good decisions, about your body.
Yeah.
Yeah, absolutely. Absolutely. So share with us a little bit more about some of the maybe the secrets that you know that aren't really out there because there's lots of books on thyroid, right? And a lot of people working with thyroid, and they're all going to come at it from a different angle. And I kind of always say there's different strokes for different folks,
Sure.
right? We're going to
Absolutely.
resonate with different people, for whatever help we need, right? Whatever help we
Yes.
need. So what makes your experience and everything unique? What is some of the secrets here?
I would say what really differentiates, and I won't even take credit, what differentiates my team and the Advanced Thyroid Hormone Clinic, as well as what I put in the Thyroid Fix,
Mm-hmm.
is that we we truly personalize treatment and we
Yes.
blend. I'll call it Western medicine because I guess when you're talking about medications, like we had that conversation, medications, hormone replacement, when we're
Mm-hmm.
talking about thyroid hormone replacement, we'll put it into the Western category.
Mm-hmm.
So we bring in that Western medicine, we bring in the Eastern or functional medicine, the
Mm-hmm.
nutrition, the lifestyle, the gut, the adrenals, all of that. We pair them together. And we
Yes.
do not poo-poo the use of thyroid hormone replacement because it's powerful and it's beautiful and it's so good. I actually recently, and I will get back to your question, but I want to share this. I recently did a webinar of it was called Why You Can't Heal Your Thyroid Naturally. And
Mm-hmm.
it's kind of meant to make you chuckle a little bit and make you interested. But
Mm-hmm.
basically, what I went into during that webinar is the truth is that very few people, if you've been dealing with Hashimoto's, which is autoimmune, if you've been
Mm-hmm.
dealing with that for years, if not decades, your thyroid has been beaten up to the place where it's kind of jagged and itty bitty, and it's just not. I don't care how many adrenal supplements and meditation and sleep and protocols that you do. You can
Mm-hmm.
dump another 30 supplements on your body, and you're not going to regrow your thyroid to make it produce the right amount of thyroid hormone that it should. So
Mm-hmm.
that's where I come in and I say, listen, I know how you're feeling. I know why you're asking that question. Can I heal my thyroid naturally? Because the combination or the medication that you're on right now, if it's Synthroid, if it's Levo, that's not going to work. You're never going to get optimized, FYI. If you're not on the right personalized blend for you, you
Mm-hmm.
are never ever going to feel good. And of course, you're going to be like, why the hell am I on this? I don't want to take this anymore. Can I heal it naturally? But when we put you on that beautiful combination, you know what you change
Mm-hmm.
to? You go, you are going to have to take this thyroid hormone replacement out of my dead cold hands before I give it up because the way that I feel right now is the best I have felt in 50 years and I'm
Mm-hmm.
not giving it up. And so that's what we bring in the clinic. That's what I brought to this book because like we were talking off
Yes.
air, I've read every thyroid book under the sun.
Mm-hmm.
One single practitioner that has had the guts to come to the table and trust you as the reader, the listener, to
Mm-hmm.
understand your body, to read
Mm-hmm.
your own labs. Yeah, you're smart enough to do that. And to understand what maybe combination and dose of this beautiful thyroid hormone replacement that you need to be on. And at the Advanced Thyroid Hormone Clinic, we don't put a cap on anything. If you need 200 micrograms of T3 because you're an anomaly, we're not going to deny you that. We're going to treat you like a personalized, unique, N of one individual. And we are going to work with your unique biochemistry to figure out what you need. And we're going to personalize, truly personalized treatment to you. Now we can do this with our eyes closed, blindfolded, hands tied behind our back and in our sleep. But that's the big difference. I mean, we've had patients
Yes.
come from other functional practices, other thyroid clinics, other hormone clinics. And they tell us, like, well, my doctor has a cap on how much NDT they'll give, has a cap on how much
Mm-hmm.
T3 they'll give. And I'm like, well, a cap isn't personalized. A cap is a one size fits all. And that's not going.
Right. Right. That's so good. That's so good, Dr. Amy. Absolutely. You have got to treat, and we're all biochemically different.
We are.
We're all different beings. And then we also go different chapters in life too. So
Hmm.
different things are going to affect us at different times. And so that's why you said, hey, get your labs checked twice a year so
Yeah,
you know where you're at. So, and you can personalize it. That's really, really beautiful. And speak to us a little bit about the brain. So I'm a brain expert, right? I work a lot with the brain. I've done neurofeedback for years, put together a whole system on the brain that's body, mind, spirit, and soul. And our listeners know that here. And you're going to notice some certain things that are going to happen with your brain that could be a sign that you need to look at thyroid stuff. Besides the obvious brain fog, what else do you see that might be a symptom or something that needs to be addressed? And it could be thyroid.
absolutely. So besides the most obvious, the brain fog, the
Mhm.
fatigue, kind of that heaviness that you feel, like almost like a heavy pressure on your head.
Yes.
We also have mood disorders. So depression, anxiety, even there are even some functional psychiatrists now, well, not even now. I mean, this has been going on for the last 20, 30 years. Functional psychiatry has now taken note that we have more T3 receptor sites on the brain than any other organ of the body. So
Interesting.
they're using T3 to treat severe mental disorders like schizophrenia and bipolar, and it's working. And these people
Mm.
are being allowed to stay off of the antipsychotics that really diminish quality of life and have their own set of side effects, including thyroid dysfunction with lithium,
Mhm.
that have their own set of side effects with it. So we can use T3 and improve mood and severe mental conditions. We now know that there's a tie to Alzheimer's and Parkinson's, that a non optimized thyroid, and this means you're walking around undiagnosed or you're diagnosed, but you're not on the right treatment, is at a
Mhm.
significant increased risk of Parkinson's disease. So we do see that
Mhm.
memory loss, that
Mhm.
low dopamine, that low serotonin. Think everything low and slow, hypo low and slow. Mood,
Okay.
motivation, brain function, processing, memory
Right.
down. You just think like, oh, that heavy brain. So
Mm-hmm.
really that's one of the first things that changes when we start
Mm-hmm.
optimizing someone. And I let them know that. I'm like, listen, you're not going to lose weight for like you probably like 6 to 10 weeks, but your
Mm-hmm.
brain's going to light up first. And that's the first thing that we hear. They're like, whoa, it was like 2, 3 days, the lights got turned on. What's happening right now? And
That's
it's
great.
fantastic because it's almost like like when you clean a
Yes.
dirty windshield, like you
Yes.
clean it and you're like, I can see. This is amazing.
Yes.
Yeah.
Oh, I love that. That's such a great explanation of this. Oh, very, very good. Because I kind of live that too. So I understand it from that point of view for
Mhm.
sure. And I'm sure our listeners can relate to that. So definitely, absolutely. Hey, when you're not in the clinic and you're not helping people with thyroid, we want to get to know Dr. Amie outside of work. What are some of your hobbies? What do you like to do, Dr. Amie?
Well, I am a big hunter. So my husband got me into bow hunting and gun hunting. We hunt white-tailed deer. Yes, we eat the meat. We love the meat. We love venison. So that's a really it's like a peaceful challenge. Talk about like going into parasympathetic and you shift quickly from parasympathetic to sympathetic. So you're in the tree stand, you're chilling, it's nature, you're taking in the fresh air, the sunshine. And then a big buck comes by and it's like parasympathetic, sympathetic. And now you're into like challenge mode, type A, all of that. Yeah. Yeah.
That's beautiful. Oh, that's really, really beautiful. That's so awesome. Absolutely. What would be a brain tip that you'd like to leave our audience with today?
Oh, that's a good one. I think the biggest thing that has helped me, especially as this, Louise, that type A driver, entrepreneur mind, just go, go, go,
Mhm.
go, go, go all the time.
Mhm.
I have actually incorporated in because you actually have to choose to do this and block it out as an entrepreneur. I have chosen to incorporate in times in my day where I don't do anything. And I know that sounds crazy. It's like, well, what do you mean? Are you taking a walk? No. Like I'm sitting without my phone, without my computer, without the TV,
Mhm.
without distractions, and I'm
Mhm.
just letting my mind just process and think and flow, and wherever it wants to go, it goes. And sometimes I'll set a timer, 10-minute timer. Sometimes I'll just
Hmm.
close my eyes and let it go until I'm ready and open back up again. But and you can speak more to this. I know there are
Hmm.
studies backing it because I heard it somewhere, that allowing your brain that break, even if it's a
Hmm.
short break, that 10-minute break from distractions, from thinking, from the electronics, from all the things, social media, blah, 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 checking emails, it actually makes you more productive.
It
It
does.
allows you in 10 minutes, it's going to make
Yes.
that next hour 10x more productive in a calmer state than if you just keep going and keep checking and keep doing and keep making
Right.
the phone calls and keep texting. Yeah, so that's what I do.
I love that. That's a great brain tip. I want everyone to hear that here. And incorporate that into your day like Dr. Amie suggested here. And finally tell us how they can get a hold of you, Dr. Amie, where we can get your book.
Absolutely. So you can go to dramie.com, DRAMIE.com, and you're going to see a little become a patient, book a call tab up in the corner. You can click that
Mhm.
if you're interested in working with us, if you're interested in exploring, figuring out what your thyroid and your hormones are doing. That's our jam. You can absolutely book a free call. We'll walk you through it. We'll walk you through the programs. We'll see where you are at. What are your
Mhm.
symptoms? What have you tried? What have you not tried? How many doctors have told you that you're normal? We're going to unpack all of that with you. And then from
Nice.
there, on that site, you can click we have free resources. We have a 7-day thyroid reset. That's going to actually kind of shed some light on, do you have a thyroid problem? And if you do have a thyroid problem, definitely do the 7-day reset because that's going to help you kickstart your progress. And of course, the Thyroid Fixer podcast, great resource. The Thyroid Fix book you can get on, I recommend Amazon because you can
Mhm.
choose the hardcover, Kindle, or the Audible, like you listen
Mhm.
to, where I
Mhm.
actually add in bonus material at the end of every chapter as well.
Oh, that's beautiful. Absolutely beautiful. Gosh, thank you so much for being with us and sharing your wisdom today, Dr. Amie. This has just been such a gift. And remember, everyone, follow your heart, but take your brain with you.